There are three types of bone growth that we will talk about. Just briefly, I want to mention that intramembranous bone growth, or ossification, is how the flat bones grow. Now, that would include some of the bones of your skull and some of the bones like your sternum and your rib cage. We're going to primarily focus here on endochondral ossification. Let's pick on that word for a minute. Endo means inside. And chondral, that sounds familiar, right? That should. That's cartilage. And of course, this is how bones grow longer. So if you've got a 5-year-old's bones, over time they grow longer and they become a 10-year-old's bones. So there is cartilage inside of our bones at the ends when you're a child, and that endochondral growth process occurs at these two regions of cartilage. Now, those two regions of cartilage are called epiphyseal plates. They are made up of hyaline cartilage, and those cartilage cells are responsible for pushing the cell longer. Okay, so there's a region of osteoblasts, and I'm going to use them as a dotted line right behind here. And those osteoblasts are going to be chasing behind these epiphyseal plates. And as the cartilage is growing, the osteoblast will transform this cartilage areas into bone, calcified bone. So that's what we call endochondral ossification, this type of bone growth. There is cartilage on the inside of our bones at the epiphysis, and of course that is the epiphyseal plate that allows for lengthening of those bones. Now, once you reach teenage years, of course, this is all done, and that epiphyseal plate transforms into an epiphyseal line. We're going to go through the details here in just a moment. The last type we'll discuss briefly is called appositional growth. It contrasts endochondral ossification because it makes the bones grow wider. And unlike endochondral ossification, it occurs during your entire lifetime. Endochondral ossification will tend to stop sometime in your mid to late teenage years. So the only type here of these three that can continue throughout your entire lifetime is appositional growth. So osteogenesis is the formation of a bone. Ossification, we know, is the transformation of tissue to a calcified structure. So we start with osteogenesis. That is the time when a fetus forms a skeleton before birth, and of course that will involve ossification, which is the transformation of that tissue to a calcified state. So let's start with step one here. We see a hyaline cartilage model, this bone here, and I hesitate to even call it a bone because our thoughts of bone include, calcified structure. So we're going to say that this structure here is a hyaline cartilage model, and it has osteoblast. I'll say that these things on the outside, they are osteoblast. So, do you know what osteoblasts do? Osteoblasts are responsible for depositing calcium to our bone. They assist in this calcification process. Blood vessels grow into this area, and we start to see a periosteum begin to form. The periosteum, you may recall, is the outer surface or outer covering of the diaphysis, or the shaft. In step two, we see a primary ossification center locate itself in the middle of the diaphysis. Primary, I'm going to abbreviate as 1 with the degree symbol, ossification center. Let's translate that, because primary means it's the first area where we start transforming the bone into a calcified structure from a cartilage structure. So it's going to be right here in the center. Now, there are cells here that help to split it apart, so it's going to divide in half, just like taking an Oreo apart. You ever done that? Take it apart and you've got 2 cookies now. That's what we're going to do with this primary ossification center. We're going to separate it, and it's going to move toward the opposite ends of this bone. So in fact, I'm going to draw it as a dotted line here, and as it moves apart, it's going to become a secondary ossification center. So I'm just going to abbreviate that as secondary ossification center. So that's really where we want to see it set up, is in the ends or the epiphyses of these bones. Okay, so when we see this primary ossification split apart and move toward the opposite ends of the bone, there are cartilage cells that will continue to reproduce to help elongate this bone. When those cartilage cells grow and then they're replaced by calcified salts, that creates an area here in the center of the bone where those cartilage cells will die. You can see this area here begins to enlarge and gets even bigger. So those chondrocytes die, and we have lysosomes that help to remove those dead cartilage cells. We also have osteoclasts, which are bone-destroying cells that help to restructure, you might say, how this bone looks on the inside. So those cartilage cells are dividing to help elongate this bone, but we don't need the dead cartilage once it's been replaced by calcified bone. Okay, so this cavity that we're opening up here by the death of those cartilage cells is called a marrow cavity. Okay, and that's not just a hollow cavity, that's actually a site for some fatty tissue to be stored, and we'll talk more about its function later on. All right, so these secondary ossification centers take residence in the ends of our bones, and of course that is the place where the bone growth actually occurs. So I would like to talk to you more now about what happens at that secondary ossification center. All right, so let's take a look here. Ossification occurs at the ends of our bones. So you can see right here, they are looking at the epiphysis of the bone. Now, there is a layer here that we call the calcification zone. And we know that calcification is the process of depositing calcium salts. What specific cell type can do that? Not a cartilage cell, but a bone cell called an osteoblast. So when those bone cells called osteoblasts deposit bone matrix, then that area of the bone becomes hardened. Now, you'll notice that this osseous tissue covers cartilage. Unfortunately, that's not going to leave those cartilage cells alive, so they die. What comes in to degrade them or destroy them? Lysosomes. Okay, so lysosomes, we recall, are organelles within our cells that help to recycle cell parts, and in fact here it's going to recycle the entire cartilage cell. Let's take a look at another picture. Here again you can see an area of bone growth. We call it an epiphyseal plate. Okay, that's where we have cartilage cells dividing. So how do you make this hard and bony with calcium salts? Well, you have a layer of cells called osteoblasts that will transform this new tissue into calcified tissue. Notice there's a great blood supply here to bring in the calcium for this process to take place. Here again you can see a layer. This is called the epiphyseal plate, and that's the area where new cartilage cells are actively dividing. In fact, they're pushing here toward the end of the cell. This layer here is called the zone of ossification. What kinds of cells are found here? They are osteoblasts, and it is their job to help convert that new cartilage into calcified bone. So think of it this way. These cartilage cells are very slow to divide. Think about how long it takes for your body to grow an inch taller. These osteoblasts are in a slow motion race. As those cartilage cells divide and push the bone longer, those osteoblasts are chasing behind very slowly, causing that new tissue to transform into calcified bone tissue. So eventually when you reach teenage years and sex hormones say, okay, one last push to lengthen those bones, then we tend to see those ossification centers catch up with those epiphyseal plates. So this process here is how long bones grow longer. This is how we see the femur, humerus, tibia, fibula, ulna radius, and of course the finger and toe bones that are classified as long bones. This is how they all grow longer during your childhood years. So ultimately, your bone growth will stop sometime in your late teenage years, and we'll expect to see an epiphyseal plate turn into an epiphyseal line. So in step 4 on your worksheet, the epiphyseal plate will eventually be calcified by the secondary ossification center. Keep in mind, osteoblasts are found in this ossification center, and when they run over this cartilage, that cartilage can no longer divide. In fact, it will be calcified. Here's an epiphyseal plate. That means this is still growing bone. This is probably a person who is mid-teenage years or younger. The zone of ossification is probably right through here, and that's where those osteoblasts are found. So we would call that the secondary ossification center. Okay, and osteoblasts are located there. Like I said, this is a slow motion race. The epiphyseal plate includes cartilage cells that divide and push this bone longer. And these osteoblasts are chasing behind, and they are calcifying this back portion. So ultimately, this epiphyseal plate moves further and further in this direction, and the bone becomes calcified right behind it. So this is a slow motion chase. You can see here epiphyseal cartilages and a hand with bones still able to grow. There's space between these bones. So this region right through here would be that epiphyseal plate. But after the person reaches late teenage years, the epiphyseal plate is overrun by the ossification center, and that area is transformed into hard or calcified bone. So you can see there's no more room for these bones to grow. In fact, the joints here are abutted against each other, and all of these carpals have no more room to expand. So over time, by the late teenage years, we do tend to see the ossification centers overrun the epiphyseal plates, and these plates are then transformed into lines. So here again, you can see the growth occurs because cartilage divides at a very slow rate. It is replaced by bone. That process is called calcification. New cartilage is continuing to grow, so the bone can continue to lengthen. By the time a baby's born, the two regions of cartilage that are left would be this articular cartilage here and the epiphyseal plate, made up of hyaline cartilage as well, inside the bone. But by the time you reach late teenage years to around 20, 21, that epiphyseal plate will be transformed and overrun by that secondary ossification center. And that means you no longer have this zone of cartilage inside the body, or inside the bone rather, but it will be transformed into an epiphyseal line. Okay, so let's summarize what we've talked about so far. There is a region in the end of the bone made of hyaline cartilage, and this is called the epiphyseal plate. During what time of your life is the epiphyseal plate present? Let's say it's under 18 to 20, okay? And what is it making up that hyaline cartilage region? Well, it's chondrocytes, cells that can actively push the ends of our bones longer. Now, that epiphyseal plate has a region right below it. I'm going to circle this region right through here, and we're going to call that the secondary ossification center. And what kinds of cells are found in the secondary ossification center? That would be osteoblasts. Okay, so those osteoblasts are chasing behind the hyaline cartilage. The hyaline cartilage is actively dividing and pushing that bone longer, and these osteoblasts are calcifying, or in other words, they're depositing calcium salts to the layer of cartilage cells down here. Okay, and so we don't need dead cartilage inside the bone. There are osteoclasts and lysosomes in our cells that help to remodel this area, and they open up this marrow cavity. Here in this picture, it's called the medullary cavity. It's a very slow process. Think about how long it takes babies who are approximately 20 inches at birth to reach an average height of, say, 60 some inches upon adulthood. So it takes 10 to 15 years for babies to grow into a adult height. That's this process that occurs here, this endochondral ossification, is a very slow process. Now, by the time we reach our late teenage years, this zone right through here of ossification, our secondary ossification center, is able to overtake this zone right here, which used to be the epiphyseal plate. Sex hormones and puberty give you one last chance to have a growth spurt, and then the secondary ossification center overruns the epiphyseal plate. That means the epiphyseal plate must be slowing down in its growth process. So over time, this secondary ossification center marches forward and eventually overtakes that entire area, and so all of that cartilage is now transformed into calcified bone. And we finish the process by opening up this marrow cavity here. So by the time you're, say, 18 to 20, at the end of bone growth, the epiphyseal plate transforms into an epiphyseal line. That means endochondral ossification is no longer possible. In fact, by age 25, the complete calcification of that epiphyseal line has been complete. So there is, of course, no more opportunity for bone growth in that zone of the bone. Now, each end of your long bone in the epiphysis, there is an epiphyseal plate. So in people who may break one epiphysis or epiphyseal plate, there may be an opportunity for bone growth at the other end. But of course, the concern here is the bones may not be the same length on each side of the body. So let's contrast lengthening of a bone with widening of a bone. Bones grow wider throughout your lifetime and they're remodeled. It's not that they're trees and they'll continually get wider and wider. It's that your body will remodel those bone widths depending on what you do. Exercise and what your body is having to lift will have a great deal of influence over the width of the bone. So bones growing wider occur at this outer portion called the periosteum. And again, there are osteoblasts in that periosteum that help that bone to grow wider. If it needs to be remodeled, then osteoclasts will help to remodel that outer portion. Over a lifetime, an average lifespan of say 75 to 80 years, we actually regrow and restructure our bones approximately 6 times.